Okay, thank you everybody for joining us for this joint ACEIR and SALDRU seminar. We're very pleased today to have two presenters who are going to be talking to us about, they're going to be discussing research which examine and quantified the extent to which a range of taxes, both direct and indirect, government subsidies and social spending affect poverty and inequality in Ghana. Using part of these CEQ methods. Our two presenters are gonna follow each other, so I'm just going to introduce them both, and then we're going to start with Dr. Kwadwo Danso-Mensah, who is a development economist and the director of research at the International Center for Evaluation and Development, where he oversees all projects related to evidence generation and applied research. His role is to lead initiatives that involve conceptualization, designing, and implementation of research for evidence programs in Africa across various disciplines. Kwadwo's broad research interests are within poverty and inequality dynamics in developing countries, with particular focus on African poverty and inequality trends, food systems, incidence analysis of taxes and social spending, and evidence research relating to developing evidence and gap maps, evidence synthesis, and systematic reviews. Kwadwo is also a monitoring, evaluation, and learning expert and an ACEIR affiliate who works with ACEIR's Ghana node at the University of Ghana. Dr. Angela Azuma-Alu is the fiscal policy advisor at Oxfam in Ghana, where she leads its tax policy and advocacy work. She coordinates key initiatives such as the Fair Finance Project, which focuses on improving sustainability and ESG in financial institutions and companies, and the Democratic Dialogues Project on strengthening the social contract and democratic dialogue on progressive taxation between citizens and decision makers at national, regional, and global levels. Her work spans fiscal justice, domestic resource mobilization, and strengthening the social contract through evidence-based policy engagement. Other projects she has previously coordinated at Oxfam aid to strengthen civil society and media for fiscal justice, improve property taxation in Ghana, and incidence analysis of fiscal policy in Ghana. Prior to joining Oxfam in Ghana, she worked as a lecturer and researcher in several institutions in the country. Right, so the way this is going to work is kind of our usual format. Both of our presenters are online. So just now I'm going to hand over to Kwadwo, and after his presentation, he is going to hand over to Angela. And then after both presentations, we will then have questions, which I will coordinate from the floor. So we're very, very grateful to have you here. Thank you very much. And without further ado, I want to hand over to Dr. Kwadwo.
Right, thank you very much for the introduction. This presentation, as you rightly said, actually looked at how a range of fiscal policy interventions actually impact on poverty and inequality. And this is a research that we conducted actually during my time with ACEIR at University of Cape Town. And I did this together with other researchers also affiliated to ACEIR, and also the Institute of Statistical, Social and Economic Research of the University of Ghana. So Richmond, Professor Robert and Professor Osei-Akoto are all part of this research that we conducted. For this presentation, I'll just present some sort of context with the Ghanaian kind of situation. And then I'll also present some approaches that we use for this analysis. And also we'll look at the main findings bordering around the poverty and inequality impact and who benefits from the various kind of estimations that we did. And also we did some level of simulations where we were looking at the time when we conducted the research, some COVID-related interventions that were implemented in the country, and also the free SHS that was done. We tried to impose those situations on our models. So we'll give you some feedback from what we saw from them. It is very important to acknowledge that this research actually used the Ghana Living Standards Survey, round 7, which was collected in 2017. And the situations that we will be presenting relates to issues that perhaps pertained during that period, given the data limitations that we had, because the Living Standards Survey is actually Ghana's most comprehensive, standard service that we had at the time. So in terms of background context, when you look at the trajectory of growth for Ghana over the period, over more than a decade, from 2006 to 2017, Ghana has actually experienced a relatively very high and steady economic growth. But the issue about is trickling down to poverty and inequality reductions is not that so straightforward. So he realized that when you compare Ghana to most of its cohorts, like Kenya, Nigeria, Cote d'Ivoire, Tanzania, the average growth rate is about 6%, 2006 up to 2017. And it is very high compared to all these countries. You also see that it's also high when you compare it to even some regional estimates like the one for Sub-Saharan Africa and also for South Asia and others. But in terms of poverty, there seem to be some gains that we see, that there has been some decline in poverty, but in terms of inequality, the same story cannot be said. We've seen inequality increasing at both the national and even rural and urban dynamics. You see inequality increasing. So for this research, we set out to do one and answer one particular, question. What are the distributional effects of Ghana's systems of taxes, subsidies, and social spending when it comes to inequality and poverty? So we draw on the methods and recommendations that is outlined in the CEQ analysis, and we try to do this work. It is important to mention that this is not the first time this work is being done. It's been done somewhere using the GLS 6 by Steve Younger and others to do some of this particular work. But we used the updated, more improved models of the CEQ to try and do this for the 2017 so that we have 2 data points for Ghana to actually look at what is happening. Now, after the main analysis, we also do some policy simulations, like I said earlier. What is the after-money effects of the free SHS policy that Ghana implemented, and so the COVID-19 subsidies that we had on utilities? We'll get into more of it later. Now, this analysis actually covers up to about 68% of the revenue side of tax and transfer systems, and also about 20% of the spending side. We were not able to capture everything for some obvious reasons. The CEQ do not allow certain issues to practically be investigated. But I think having to be able to cover 68% of the revenue side of issues and 20% of spending, that actually is quite a good amount of information that allows us to do this analysis. There is one core thing that we should understand about the CEQ method. The method actually follows the construction of various income concepts and analysis of their respective contributions. So you actually will track the changes in poverty and inequality along the different income concepts. Just to give some highlights of this, when the concept starts with market income. And for market income, it includes all earned and unearned income before any government intervention with relation to taxes or transfers or any other thing. So this is actually the income that is earned by individuals before any of these fiscal interventions. Then we move to net market income, which refers to the cash income that is available after government has actually deducted direct taxes, like personal income tax and things like that. Disposable income can be constructed after, adding issues around taxes to market income and seeing what actually happens. When you want to actually look at the effect of transfers, then you add the transfers to directly to market income, and then you get gross income, where you can actually see the independent effects of transfers to the analysis. Consumable income, which is the next level of concept, is constructed by adding indirect subsidies to the disposable income. And then you try to deduct indirect taxes, such as VAT, import duties, and others to it. Then you get the consumable income. And then finally, we have the final income, which actually looks at how things changes when government provide free or subsidized services such as health and education. So once you add in-kind, we call them in-kind transfers like health and education. Once you add those issues to consumable income, then you are likely to, you then arrive at the final income. So the analysis then look at overall what have been the changes in poverty and inequality along this income concept. So, but when you take it from market income to final income, then you see the full effect of it. Now, this analysis actually uses consumption as the underlying welfare indicator, because the Ghana Living Standards Survey actually follows the consumption approach to calculating welfare rather than the income approach. And we also rely heavily on administrative data to make sense of the data, to ensure that what we are receiving or what we are actually judging from the GLSs makes sense with what actually government is doing on the grounds. Now, this analysis happens to come with some critical limitations, which you have to all know. We are not able to include taxes and spending such on things like infrastructure, corporate income taxes, expenditures on defense and other public goods, because it is very difficult to actually assign the exact individual benefits of such items. So those kind of categories of spending and taxes are not actually taken care of. And also, the model is a bit static at the time where I know CEQ have improved their models, but the model that we're using at the time actually do not consider behavioral or lifestyle kind of changes or general equilibrium effects. So we are not able to, for instance, look at what happens with regards to trade-offs between consumption now and consumption later. We are not able to look at certain intra-household distribution of consumptions, especially when people receive pensions and so on. And we are not able to also look at what are the behavioral responses once people are able to, pay taxes or transfers, and what triggers those kind of, other behaviors into the analysis. Also, it's important to recognize that the quality of education or health services is considered to be the same across board, just to allow us to do the analysis. We are not able to differentiate between the quality of education or health services that people actually receive. One thing, most importantly, the results of this assessment should be considered as just an input into the policy-making space. A lot of other things have to be actually considered before we actually know what is happening. And then, okay. My screen went off. Okay, so we move on to how we have been able to estimate the interventions. I'll rush through a bit quicker on this one. With regards to the direct taxes and transfers, we rely on estimates from the GLSs, where we are able to know people that are paying taxes, which we call the pay as you earn. And these are actually people report their personal income tax within the GLSs. So we use that and we try to estimate, the payee. And it is about, the tier structure which is being used. In terms of social security contributions, we use the statutory rate of 18.5% at the time of gross earnings to compute that. There was one thing that we recognized in the GLSs, it takes responses for taxes that are paid on products, especially for people that are running their own business. So we consider these taxes as direct taxes. We understand that this can actually have other meanings. People can also look at it as, let's say, an indirect tax like a VAT. But for this analysis, we consider them as perhaps direct taxes. In terms of transfers, the Livelihood Empowerment Against Poverty program is actually Ghana's largest and only cash transfer that we have. At the time of this analysis, the respondents actually directly were asked to indicate if they received payments for leave, and people actually gave their, responses. But when we counted, we realized that it was woefully very scanty when you compare it to the official government numbers. So what we did was that we have to simulate some of these things within the model. So we use the beneficiary characteristics of LEAP, kind of like, whether you are an orphan, an old person and stuff like that, to try and prop up the numbers to the levels that we find within the official reported numbers. So this is what we did to actually get the LEAP numbers quite equal to the number of beneficiaries in the administrative records. There is also another post cash transfer, which is the free meals at school. People receive, children receive free meals at school. So with the GLSS 7, there was a direct question on that. So we actually use this to compute the benefits that government actually give to people with regards to public school feeding. In the case of Younger and others in 2010, when they did this wasn't the case. That critical question was not in the GLSS 6. So they actually did simulations and did some imputations. But our case, we're fortunate to have it in the data, so it wasn't so difficult to use it. On subsidies, when we look at electricity subsidy is also very big in Ghana, and it's actually the way consumption is looked at is following the tariff, the tiered system of consumption. Depending on how much you are consuming, then you are going to pay some more. So we try to calculate this subsidy received by each household by estimating what the difference is between the average cost per kilowatt hour of consumption that you are consuming and the actual amount that you actually pay. And the difference that we find, considering the tier tariff, bounds, we are able to estimate the subsidies that you are actually receiving. So that's what we did for the electricity. And also the indirect taxes estimations. These are taxes that are levied on the proportion of the retail price or the quantity of goods that actually people consume. And we computed the direct effect and indirect effect, and also we did the effective, effective rate of imports or whatever. So while we used the social accounting metrics 2013 and the technique that Roland and Sancho actually used to calculate the direct and indirect effects of the taxes. We actually did a whole, the sum thing, input output tables, and try to relate how each item in the GLSs is actually, relating to the industries that are captured in the sum, and actually the various rates that are applied to it. We try to also link it up. So these are some of the rates that we find from Ghana's official statistics, and then we try to make sense out of it using the sum and the GLSs. For the in-kind transfers, that's education and health, we first calculate government cost of provision for schooling by level. And also when it comes to healthcare, we look at it by type, whether inpatient or outpatient. Then we calculate the per capita costs of that. We divide the total cost by the number of beneficiaries for those things. And we assume that the beneficiary receives an average amount of benefit. After, of course, we have net away the issues of fees and that we pay for that services. And this comes with certain critical assumptions. The assumption is that the cost of production of these services is actually equal to the value of consumption. And also the value of services is assumed to be constant. So we don't consider the quality of the services. So we're able to estimate the cost per beneficiary at the national average, as you see in the table on the right. Okay, so having gone through the approach, what were the results telling us? In terms of poverty, we can say that the extent to which government fiscal policies together benefit the poor compared to the rich seem to have increased if you look at what was happening in 2013 and 2017. The Gini figures for the final income was about 4.6 or 5.9 percentage points lower than what we recorded in 2013. So that seems some good news, and it is actually close to the average difference for about 20 lower middle income countries that we also compared with that have also done similar analysis. So it means that at least in terms of inequality, we compared favorably with people within the lower middle income countries. However, when you look at 16 African countries that were in that mixture, you find that Ghana's reduction was quite lower. They were making about 8.6 percentage points kind of difference. But the details actually reveals that when you look at the transitions of these kind of impact, you realize that direct transfers play a very important role. That's the LEAP and school feeding. They actually reduce this inequality by about 1.67 percentage points, followed by and also consumable to final income, where we actually look at in-kind transfers. You realize that actually reduces inequality by more than 2 percentage points. that tells you that issues around education and health is a very big game changer when it comes to the reduction of poverty, reduction of inequalities. Now, in terms of poverty, overall, the reduction in poverty rates seem to have mainly been driven by in-kind benefits that is associated with public spending on health and also education. When you check the two poverty lines, the lower poverty line and also the upper poverty line, you realize that poverty headcount actually reduced by about half and also 1/3 respectively, when you look at the movement from market income to final income. For the lower poverty line, for example, you find poverty being about 8.89%, and then when you go through the whole chain, it gets to about 4.29%. That's about half of that reducing as you move through the chain. The same with the higher poverty, the upper poverty level, from 23.7 to about 16.9. But two key things must be noted. When you look at the transition from disposable income to consumable income, where we actually net issues around indirect taxes and subsidies, you realize that the issues changes. Taxes actually increases poverty rather than the subsidy. So the move from disposable income to consumable income, see that poverty increases mainly because of what indirect taxes. Also, from consumable income to final income, that's where we see a substantial reduction in poverty, about 4.48 percentage point and 8.13 percentage point at the lower poverty line, upper poverty line, respectively. And this is largely due to the in-kind transfers related to education and health expenditures. So now the big question is that who benefits? Where does the incidence of specific taxes and expenditures actually lie? And we do this by borrowing the concentration index to try to explore the incidence of these fiscal policies and how targeted they are. So the index ranges between -1 and 1, where -1 would mean that taxes or expenditures fall only on the poorest person, and then the 1 will say that it actually falls on the richest person. But for this analysis, when you look at it carefully, for the poor to benefit, government expenditures should actually be having more negative concentration coefficients, and also taxes have to have more positive concentration coefficients. I'm not moving into the dynamics of it, but generally this is the idea that you should move with to understand the slides that will follow. So considering pensions and transfers, you realize that pensions are regressive, but other transfers are more progressive. So when you look at the pensions like the one we have in Ghana, which we call the SNET, and other pension benefits, they are regressive, given their positive figures, of course. And this is not surprising because pensions and SNET are mainly for formal workers, and on average they pay more. They are paid higher when you compare them to informal people that are more within the more likely to not be poor, to be poor. In terms of comparison, the index for contribution pensions, which is about 0.67, seems to be highly close to the average for middle-income countries. And when you look at its comparison to the previous one, it seems to have reduced. LEAP transfers, when you look at transfers, all the transfers that we have seems to be very progressive. And for LEAP especially, you realize that it is even higher when you compare it to our peers in low-income countries, when we look at what they also did for their own CEQ analysis. And the progressiveness has even increased when you compare it to what we did in the previous the Ghana case for 2013 by Steve Younger and others. The same thing can be said about the free feeding, which appears to target the poor, and it is also very progressive, and it's also clearly much progressive compared to its previous estimates. Direct taxes are very progressive. Of course, it tells you that the tier structure of the way we implement our taxes system tends to be very progressive in nature. but also taxes on products, like I mentioned earlier, is also very progressive. And this is also similar to what have been found in our previous analysis that we did for Ghana in 2013. In terms of subsidies, we realize that fertilizer subsidy appears to be very evenly redistributed. It's not so much of a whether regressive or progressive. It's quite very evenly distributed. But when you look at electricity subsidies, which we expected, although it is it has that tier tariff structure, it doesn't appear to be progressive in its nature. It has a positive coefficient, which makes it regressive. And this can be explained that when you come to Ghana, a lot of poor households live in compound houses where they're expected to use the same electricity metering kind of system. So if so many people are living in the same house using the same kind of meter, then it means that consumption quickly adds up, and they may not be able to get the kind of subsidies that they should have gotten if they were falling within certain thresholds. So that's how we think that this might be happening. Indirect taxes, aside tobacco, are found to be very progressive. We think that given the regressive nature of tobacco, it may signal that smoking may be more prevalent among the poor in Ghana. In terms of education, although the combined effects of education seem to be progressive, when you look at it carefully, you realize that it is more progressive at the preschool, the primary school, and also the JHS levels. But when you look at the senior secondary school, the progressiveness is very minimal. And this could be because the nature of the Ghanaian school system at these levels are not so attractive to the range. So there is some sort of self-selection when you come to actually the lower levels of education, like the preschool, the public preschool, primary school, and then JHS. More people in the who are likely to be poor will be patronizing the school more, because the issues of quality is of concern to much richer people who actually educate their wards in private schools, so to say. But when you take tertiary education, it is more concentrated for the rich than the poor. And the current estimates show that the higher levels of education, although it is regressive, it is less regressive compared to the previous one that was done. If we look at how this actually also is done in a lot of countries, you realize that Ghana does better than only 4 out of 19 lower middle income countries when it comes to the progressiveness of our tertiary education, in the country. I know I have just about some few minutes, but let's talk about the after money effects of COVID-19 related issues. During the COVID issues, we realized that government did a lot of things. Government gave free electricity consumption for 9 months, and also provided about 50% consumption of electricity for 3 months for free. So there was lifeline consumers had 9 months free electricity, whilst the other people, other segments of the population had 50% absorption for just about 3 months. So, like I said, government in 2017 also did the free SHS policy, and we were interested to find out what are the effects if we assume that the policy actually achieved its full implementation in 2017. So in terms of what we find for the free SHS policy, we realize that the free SHS policy has a reducing effect on both poverty and inequality. But when it comes to its progressiveness compared to the state where people were actually paying fees, it was very less progressive. So you'll find that poverty actually reduces further, when you impose the policy of free SHS on the model by about 0.07 percentage points, and also by 0.22 percentage points at both the national lower and upper, poverty lines. But when you look at the inequality, we realize that inequality also reduced for households. But like I said, in terms of the progressiveness, it was less progressive when you compare it to the time when people were actually paying some fees. And we think that this is actually something that should be expected because the policy was not really targeted. It was very blanket. So at the time, at the beginning of the policy, it is likely that the data that we have as at then had more people who could actually afford to pay into secondary education than expected. So in the beginning of the policy, it seems more rich people actually may have actually, benefited. So that's why we put the strong caveat on the reason why we are saying that it is less progressive, that the analysis, remember we said, is static. It does not look at behavioral responses, especially with the fact that this may mean that going forward, more poor people can now go in free. By the time that we're looking at the data, people in secondary school are likely to be more people that actually were able to afford. All right. In terms of the water and electricity subsidies, we realize that both, subsidies actually reduces poverty, but inequality seems to increase after the water subsidy. And also reduces marginally after the electricity subsidy. So in effect, you don't see any real net effect on inequality. And we think that the fact that inequality for the water subsidies actually increased also could be because it was also very blanket compared to the electricity subsidy at the time that was a bit targeted. And in terms of progressivity, we don't see much, when it comes to progressivity, when you consider the electricity and water services that were given during the time of the COVID. Of course, the water was quite less, slightly more regressive compared to that of the electricity. And we think that this is basically due to the issues of access. Those that have access within their compounds will be benefiting more from these subsidies compared to those that do not have, who were actually more of the poor. And just to let you know that we tried to publish this work in the Cogent Economics and Finance. So there is more you can read about this research work when you look out for it. In the interest of time, I will end here. Iman, thank you so much. Comments will be welcome.
Okay, all right. Okay, so I think we had the opportunity to partner with the research team to disseminate the findings of the research. So I'm just going to be sharing briefly on that. Maybe just to give a brief background. So Oxfam has been working in Ghana since about 1985, and then the main aim is reducing poverty and inequality. So the mission and vision are basically to create a just, equitable, and then sustainable society where those with power are held accountable and citizens also realize their rights. So, which means that anything that relates to poverty and then inequality tends to be quite of interest. So we have the opportunity to be part of this project. It was actually funded by GIZ, right? So we collaborated with the GIZ office in one of their governance programs in Ghana as well. And as part of the dissemination activities, there were a number of things that we did. So first, I think because of just how complex the research was, one of the things that came to mind was that in order to put it in a form that would be more easily digestible, it would be good to have a policy brief. So we had a training, right, for actors from civil society and then academia in Ghana. we were able to reach about 15 institutions. So we had representatives from civil society organizations, maybe working in different areas. So for example, we can talk about the Tax Justice Coalition that works in areas of tax, the Media Foundation for West Africa, which is a media advocacy organization, EduWatch that works on education policy, the Africa Center for Energy Policy that works on energy and extractors, NORSAC, which is a community development organization, also the Ghana Anti-Corruption Coalition, just as the name sounds. So we have brought a number of actors from civil society and academia together. They were introduced to the research, right? A policy brief had been developed, so their inputs were taken in for the policy brief, and then also develop some advocacy strategies. And it was great to see that after the training, we had some participants sharing their experiences on social media and then also writing articles for advocacy purposes. Following that, once the policy brief was ready, we now organized a lunch. So with that, we had about 17 institutions participating, so both from development partners. So we had, for example, the Danish Embassy, the Swiss Embassy participating, from civil society organizations, from academia. We have the University of Ghana, from some regulatory institutions such as the Bank of Ghana, the ministries, departments, and agencies. So we have the Ghana Statistical Service, the National Development Planning Commission of Ghana, that's in charge of creating long-term plans for the organization, for Ghana, as well as the Ministry of Finance and then the Ministry of Gender and Social Protection. And then within the lunch, there was also a policy dialogue where some policy options were shared. So there was some news coverage of the event. There's a link to one, and then this article, as you can see, that was written up after the event. And then in addition to that, we also had the opportunity to disseminate the findings at a regional and then global level. So the Tax Justice Coalition is a member of the Tax Justice Network Africa, and every year the Tax Justice Network Africa organizes a conference, a Pan-African conference on taxation and illicit financial flows. I think the last one that was in 2026 was actually in South Africa, right? But in 2023, it happened in Ghana. So partnered with them to organize a site session where the research findings were disseminated. Although the picture is not very clear, that's Dr. Kwadwo sharing the findings of the research. So there was some news coverage on that event as well. And in addition, so the project was run simultaneously in Ghana and Indonesia. So the team, that's Oxfam in Indonesia, organized an online global dissemination webinar. And then we had Dr. Richmond and myself joining to share the experiences from the research. And basically, this provided an opportunity to share the experiences beyond Ghana to more regional and then global level. And following that in 2023, even after the project had ended, we had the opportunity to collaborate with the World Bank Country Office in Ghana, right? So they had developed a micro-simulation tool that was based on the CEQ methodology, and basically to provide like a more simplified tool to help simulate and then analyze the impact of fiscal policies. I think just as Ujo has already explained. So based on this, we partnered with them. So we have the then economist at the World Bank, that's Paul, presenting the micro-simulation tool. And then following that, we had a training as well on for actors from civil society, academia, as well as some ministries, mainly the Ministry of Finance and then the Ministry of Gender and Social Protection. And we had some feedback that some people had tried their hands at using it for some analysis following their training. Maybe I'll just share some quick reflections on this. I think although it was quite a short project, I think one of the main things that stood out for me was the different areas of collaboration that came in. So we have the funding coming from GIZ, right? Through Oxfam in Germany to Oxfam in Ghana, and then collaborating with the researchers at ISSER, then even beyond that, collaborating with the World Bank, with the Tax Justice Coalition, and then the Tax Justice Network Africa for the dissemination. And even after the project had ended, there was additional funding from other projects that supported with, for example, the launch of the microsimulation tool and then the regional dissemination side events that we had during the Pan-African Conference on Tax and Illicit Financial Fields. But at the same time, it's important to acknowledge the challenges that because the project duration itself was limited, right, it meant that once it ended, there was essentially limited focus and then limited funding for further advocacy that could be done. Because with things like this, because of how complex they generally are, it's good to have several sessions so that it makes it easier for more people to understand. And then in addition, advocacy can be very slow. So usually additional funding helps with the consistency, which leads to making a difference. And then of course, we would also have to acknowledge the length of time that it takes to get the GLSS data, because I think at the time that we were organizing it, we engaged the Ghana Statistical Service, and they mentioned that they were just now getting started on the data. So which means that it's going to take quite some time before the new data set is ready. And as Kwadwo alluded to earlier, even by the time that they were doing the research, the data itself had existed for quite some time. So it meant that it may not necessarily be reflecting very present realities, although it's still good for academic purposes to be able to see what has happened over time. So I'll just end here now, and then we can take any questions. I thank you.
Right, thank you very much to both of our presenters. That was really very interesting. Yeah, I see that we have a hand up in the room, so that's Diana. So why don't you go ahead? People should raise their hands both online and then also in person, and we can come around. But let's start with Diana if you want to ask a question. And please just introduce yourself very briefly. You are muted currently.
Hi, my name is Diana. To both our presenters, if I remember correctly, Medase, which means thank you. To the first presenter, your results speak to something very interesting, where you said that for the post-secondary education, we don't really have like benefits, like, yes, we are spending, but it's not really benefiting the poor. Given we're using household surveys, and for sure we're not capturing the rich, is it that these things are benefiting the rich, or is it the middle class? I ask because I'm very worried that we can end up with a very equal society of poor people. So is the idea to be equal but push everyone at the bottom of the distribution, or is the idea try to be equal but push everyone towards the top of the distribution? Because these people that we're calling rich, are they really rich, or are they middle class? And once the government is to, for instance, not like follow up on policy and say, okay, I think let's invest more on primary school and all this, are we going to have those skills that are needed to really take these countries to the next level? So I'm just worried that the people we are calling rich who are benefiting from this, actually the middle class, and withdrawing funding means that education at the higher level is actually going to be constrained only to the rich. Thank you.
Thank you. I just maybe if there's we'll take one or two more questions and then we can ask our presenters. Well, I have a question. Anybody else in the room or online? Okay. So my question, yeah, thank you again, both of you. My question, I was thinking about it especially during Kwadwo's presentation, but if you both have views, I'd be interested. Sorry, I'm Josh Badlander from SALDRU. I'm always struck by the quite strong growth performance of Ghana that you showed us, Kwadwo, and then the poverty reduction. And I was wondering if there's some kind of breakdown that you guys have done with the CEQ method or otherwise that kind of shows how much of the poverty reduction is due to market incomes, which I know you look at improving over that period, versus the growth increasing kind of social spending, and that's having a big poverty reduction. So I'd be interested in those, if there's been some work looking at those two different kind of causes. If there aren't any other questions, maybe we can start with those. Okay, so why don't you, our presenters, come in?
All right, thank you. I think I'll start with the first one regarding a question on education. You realize that for the secondary education, it was not regressive in total, right? It was less progressive when you compare it to the other lower levels of education, meaning that when you look at secondary education, especially at the time that we have this data, this was quite before the free secondary education. So that would mean that at that time, more households that are in the upper distribution. And I understand why you don't want us to say rich or so, because we categorize it based on some sort of poverty lines, right? So once you fall beyond the poverty line, we don't consider you poor. So I understand, why perhaps we should be categorizing maybe poor, middle class, or very rich, and so on. We didn't really do that. So generally, when we say that it's benefiting more of the poor, we are looking at those below those lower and upper poverty lines, and then those that are much above, we consider them perhaps able to afford much more, other things. So for the education in particular, the secondary education was, less regressive when you compare it to, the other upper levels. And it was also less progressive when compared to the much lower levels of education. And the reason why we highlighted that is because in Ghana, before 2017, that's before the free SHS system, a lot of people will want their children to go into secondary education because there is some pride around, old students, and, there is some tiered level of secondary education in terms of the public secondary schools that even the rich will want their children to go. So secondary education is more, open to both rich and poor compared to the lower levels, which is not considered attractive by the more those that are, willing to actually able to afford. So that's the explanation I can give around that. But I get your point. Perhaps we should find a way of maybe saying middle class, upper class, and try to find some thresholds for that. I think there will be some work that I've seen that try to do those kind of things. On the question by the second question, I'm not so sure if I understood it, but when we look at when we say that the first slides, when we talk about how growth within the country has been like, and why it is not trickling down into, reducing inequality and so forth. There has been some studies that try to explain some of these things, but very few studies try to look at it in the manner that we are looking at it. Indeed, there has been just 2 data points that actually considers, government fiscal expenditures and or fiscal issues and how they actually mean for poverty and inequality. So we are hoping that we'll be able to, maybe given the next round of data, with the GLSS 8 perhaps, we could see how maybe this kind of growth maybe also maybe making any sense out of this, whether we are getting more traction in that area, or perhaps we are really retrogressing. I'm not sure if I answered your question.
Thank you. Angela, I don't know if there was anything you wanted to add in response to the questions.
No, not at the moment.
Okay. Yeah, great. We see Benjamin has his hand up. So Benjamin, please go ahead and ask your question. You are still muted. No, Mike, sorry, that was I think you should be able to unmute now.
Yeah.
Yes.
Yeah. Hello, please can you hear me?
Yes, we can hear you.
Yes. Thank you very much, Dr. Kwadwo, for the wonderful presentation. I was thinking if the metadata sheet for this research is still available, so that we can also have access to it. I mean, the metadata sheet for this analysis, I would like to know if it's available. Thank you.
Okay, and then we've got another user who's got their hands up. You can unmute.
Okay, thank you very much. My question goes to both presenters. I want to know eventually what is the policy recommendation that they are giving to the government. What should the government do based on the research that they carried out? Thank you.
I'm sorry, can you quickly just introduce yourself just so we know who you are?
Okay, so my name is Kwabna. I am a researcher with the University of Ghana.
Thank you. All right. Okay, I think let's proceed with those two questions then, please. Maybe we can start with Angela and then go to Kwadwo this time.
Okay, all right. Thank you very much. So I think one of the very immediate recommendations, right, based on the research, as you mentioned, was really about how sometimes electricity subsidies tend to be regressive rather than progressive. Because as Kwadwo rightly mentioned, sometimes it's assumed that, for example, subsidies on electricity should benefit those within the lower income bracket. But as you mentioned, based on the research, one of the findings was that those who tend to be, should I call it poorer? Yes, tend not to benefit as much because of perhaps the compound nature of houses that we also have in Ghana. So which means that calls for much more targeting rather than like just wholesale reduction. So actually one of the advocacy articles that was written by some participants related to this particular recommendation.
Thank you. And Kwadwo?
Okay, so to add to what Angela said, we realize that the analysis showed that direct taxation is more progressive than indirect taxation, right? And this kind of, I know this recommendation has been given several times. So, but it tells us the importance to actually expand the number of people actually paying direct taxes. Trying to make the informal economy much more formal so that people can pay more tax, because that seems to be very progressive when you compare it to other indirect taxes that we saw in the analysis. Also, social interventions such as the LEAP and also the school feeding programs were very much pro-poor. So the recommendation would be that you should expand these policies, try to be, and these are also very targeted. So perhaps expand the policies to cover more beneficiaries. Maybe rather than beginning every time when there's a new government, there are new policies that are coming up, and most often than not, there is this thing that we call early capture by the rich when policies have not really been implemented for a number of years. But these LEAP and school feeding seems to be very entrenched. And rather than starting new programs, perhaps let's see how best we can minimize the little issues of implementation challenges and expand it much more further. This is what I'll add. In terms of the metadata sheets, yes, we still have the do files that we use for this work. They are still available, and it can be replicated at any time.
Great. It is now 2 o'clock, so I think we're going to close. Just wanted to say thank you so much to both of our presenters for this really interesting research and discussion, including the policy discussion. And thank you very much also to our audience for their questions. Before I let you go, I just wanted to highlight and advertise that we have another seminar on the 13th of May, which has a similar analysis, but for Kenya. So we hope that you will join us then, though we will, of course, advertise close to the time as well. Thank you very much, everybody, for attending, and especially to Kwadwo and Angela. Thank you. Bye-bye.
Bye.
Thank you. Bye.